All right, welcome back to ABA exam review and our sixth BCBA practice exam. As usual, we'll go through the next questions together and break each one down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our other practice exams and our study guide. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. 11. A client of yours is experiencing spontaneous recovery, which has led to aggression towards siblings. What should you instruct your behavior technician to do first in this situation? So the question is asking about what we do first. And these little caveats and details in the questions are very, very important. That's how the questions are going to increase in difficulty. That's how you're going to get tripped up if we're not slow and careful. And so that's why we do all of our work up front in the question before jumping to the answer choices. So what should you instruct your tech to do first in the situation? Well, what's the situation? The client is experiencing spontaneous recovery. What does that mean? It means that a previously extinct behavior has suddenly reemerged. We expect this, right? Spontaneous recovery is not uncommon. It's something we plan for. And so a spontaneous recovery occurs, in this case, aggression towards siblings. What are we going to tell the technician to do first? A, conduct a new preference assessment to determine if the client is satiated on reinforcement. Is that going to help in the moment? No. Remember, when this happens, we've got to act in the moment and we got to respond in the moment. Conducting a brand new preference assessment is not going to address any of these problems or situations at hand. B, implement a punishment procedure to reduce the behavior quickly. Well, we're certainly not going to implement a punishment procedure for a behavior that we've already gotten rid of through extinction. And that's what we need to remember about spontaneous recovery. When spontaneous recovery occurs, that means the behavior was already extinguished through extinction, meaning we can do it again. C, intervene using the behavior plan that was used in the past. So that brings us to C. That's what we're going to do. Whenever spontaneous recovery occurs, your first reaction and response is to implement the old plan. And whatever that old plan was is what you do in the moment, at least. Now, if it continues to occur, you can reassess and reevaluate. But again, with spontaneous recovery, you've already successfully implemented an extinction procedure. Continue to do that same procedure. Likely, and what typically happens, is the behavior once again reduces or decreases very rapidly. C looks good. What about D? Inform the parents and then keep the client safe. Well, we're not going to inform the parents first. First thing we need to be worried about is what the tech's doing. The worst thing you can do during spontaneous recovery is accidentally reinforce a behavior that was extinct. So we don't want to do that. The first thing we need to do is intervene using the behavior plan that was used in the past. Again, to do first is very important in this question. 12. A behavior analyst works with a nursing home as part of a one-year contract. Two of the tenants are telling the analyst one day that the new method of helping residents out of bed is complicated, and they are unsure if they can do the procedure as instructed. They also do not believe that the new procedure will work. If the behavior analyst were to describe these qualms using the dimensions of ABA, which ones would they use? Question is asking about dimensions of ABA, and we're going to use the dimensions of ABA to describe the qualms of who? Well, the attendants. And so we've got all these moving pieces, and we're slowly creating a picture of what we're going to evaluate to answer the question. So we're going to identify, looks like, two dimensions of ABA to describe what the attendants are talking about. So it's a nursing home. The behavior analyst is working on a one-year contract. The attendants tell the analyst that they have a new method of helping residents out of bed, but it's complicated, and they're unsure if they can do the procedure as instructed. Okay. And they also do not believe the new procedure will work. So the first thing is these attendants who were instructed and trained don't believe they can do the procedure. What does that sound like to you? Well, to me, that sounds like technological. Technological says rewrite and design interventions so that any competent individual can replicate them. These attendants don't feel like they can do that. So apparently it's going to lack technological as part of a dimension. Second, they do not believe the new procedure will work. And that one's a little more obvious. What is our dimension talking about? Will a procedure work or not? Well, effective. right? Effective means we're making change to a considerable degree. And something quote unquote working is effective. Just because we make a small change, if it's not a change that's significant, we don't consider that working and effective. So, according to the dimensions of ABA, if these residents who are trained can't do the procedure, it isn't technological. And if they don't believe it's going to work, they don't believe it will be effective. So A, generality and applied is neither of what we're talking about. B, we have effective and analytic, so we're missing technological. C, technological and effective is what we're looking for. And then D, conceptually systematic and technological. C is our answer. In dimension questions, you've got to be very, very specific on what the question is addressing, because a lot of the dimensions have some crossover. They feel like they can represent some of the same things. You want to be very diligent. And as you notice, since we did all of our work up front, we essentially were able to predict the answer before we even got to the answer choices. And once you get really good and fluent, you're going to find yourself doing that more and more. 13, a middle school teacher requests the help of a behavior analyst in designing an effective measurement system for a class of 20 kids. The middle school teacher wants to spend as little time as possible observing behavior. Which of the following would be the worst type of measurement to use given this information? Measurement question, and we're looking for the worst type of measurement. So we're picking a measurement and the worst type of measurement for what? What are we measuring? Well, the teacher wants to measure a class of 20 kids. And whenever you see a big group in a measurement question, you should immediately start thinking, okay, discontinuous, because continuous measurement is very tricky with a lot of kids. So the middle school teacher specifically wants to spend as little time as possible observing behavior. And that's the kicker. So we want to observe, or we want to measure 20 kids, but we want to spend as little time as possible observing behavior. If this is the goal, what's the worst type of measurement to use given the information? A, play check. Well, the play check, that's essentially momentary time sampling for a group. And the only time you're going to be observing is at the end of each interval. So play check would actually be a pretty smart choice given the scenario. What about B, permanent product? Well, with permanent product, theoretically, you don't have to observe the behavior at all, right? Because we're observing the result or the product of the behavior. So if she wants to spend as little time as possible observing behavior, permanent product would grant that wish. C, partial interval recording. Well, partial interval recording, even though it's discontinuous, you still have to observe the learner the whole time. Because if your interval is 30 seconds and the behavior is not occurring during 30 seconds, you're still observing during the 30 seconds. So you're definitely observing more in a partial interval recording measurement system than A and B. And same with D, because momentary time sampling is just play check for a single child. And with momentary time sampling, you're only observing at the end of an interval. So the one where you're going to be spending by far the most time observing the behavior is going to be C. So that's going to be the worst type of measurement if this teacher wants to spend as little time as possible observing behavior. 14, Angie has significant experience working with children with disabilities, including autism and intellectual disabilities. On her website, she promotes herself as a behavior specialist who uses applied behavior analysis to formulate effective behavior strategies. If Angie is not a board certified analyst, has she done anything wrong? Now, this is an ethical question, and Angie is not a BCBA, right? She's not a behavior analyst. And so on one hand, she doesn't have to adhere to the BACB ethics code. But on the other hand, people aren't allowed to misrepresent themselves as analysts. You've got to ask yourself, is Angie misrepresenting herself as an analyst? Well, nowhere in here does she say analyst, does she say BCBA, does she say anything like that? She just says, I'm a behavior specialist who uses applied behavior analysis. And there's not anything necessarily wrong with that, right? We want ABA to be promoted. We want ABA to be used in different situations. We're not sure of Angie's training. We know she has significant experience, but Angie is not necessarily misrepresenting herself, and she's not necessarily doing anything wrong. So has she done anything wrong? A, yes, Angie has misrepresented herself as a certified behavior analyst. She's not. She never said she was a BCBA. She never said she was certified, licensed, any of those things. B, yes, only certified behavior analysts can advertise the use of applied behavior analysis. Well, that's certainly not true, right? BCBAs don't have a monopoly on ABA whatsoever. C, it depends on if Angie received approval from the certification board to advertise. Angie doesn't need approval, right? She's not an analyst. She doesn't adhere to the BACB guidelines. Now, she should be ethical, and there's a lot of other things Angie should be doing. That's not what the question is asking. And that's an important lesson. We're only answering what the question is asking. Okay. There's a lot of factors that would go into whatever's going on in Angie's life, but we're only using the information given. And with the information given, Angie's done nothing wrong. So no, Angie has done nothing wrong. 15, now that Nick's son is walking, his son wants to climb on everything. Nick implements a behavior plan effectively reducing the climbing at home. If Nick's son attends a daycare program, what can Nick anticipate? All right, I think this should be a relatively easy question if you've been working on your fluency or if you're already fluent. And remember, not every question on the exam is going to be the hardest question ever. So when you get an easier question, trust your training, trust your learning, trust what you know, answer it, move on. So to me, this looks like behavior contrast, textbook, right? Nick's son's walking, he's climbing on everything. Behavior plan reduces climbing at home. What's going to happen in the other environments if we don't change the plans? Well, behavior contrast. So at the daycare program, if climbing is reduced at home, what's going to happen to daycare? A, avoidance by his son when it is time to go to school in the morning. There's no indication he's going to start avoiding daycare just because we're reducing climbing at home. B, Nick is likely to become an aversive due to reduction of focused behavior plan. No, not necessarily. Nick might be using some sort of differential reinforcement procedure. We don't know what Nick's plan is, but there's no sign that Nick's going to become an aversive just because he's reducing behavior. C, there is likely to be an increase in climbing at the daycare program. Yeah, based on our knowledge on our ABA terms and what we know about changing behavior in one setting, it's likely to go the other way in another setting if we're not changing behavior in that setting as well. So if it's reducing at home, it's likely to increase at daycare. And then D, there should be a decrease in climbing at the daycare as well. No, it's much more likely there's going to be an increase in climbing at the daycare program. So what does Nick need to do? He needs to let the daycare know, and they need to start working on it as well. 16, Cassandra engages in skin picking, which can occasionally lead to serious wounds and a need for medical attention. You determine that you want to intervene as quickly as possible. What withdrawal design should you use if you choose to use a withdrawal design? First things first, likely you would never use a withdrawal design for this behavior, but you are taking every question at face value. Whatever the question gives you, you answer. You're not there to judge the validity of the question right or wrong. Doesn't matter. Whatever the information the question asks or gives you, you take and you answer the question. Okay. So yes, we likely would never use a withdrawal design for a behavior like this, but if you were to choose one, what would you use? So we want to do what? Well, we want to intervene as quickly as possible. Okay. And so what withdrawal design are we going to use? A, an ABA. Well, an ABA withdrawal design is baseline, intervention, baseline. That's not intervening quickly because we're just taking baseline. B, a BAB or an intervention, baseline intervention, is much more what we're looking for because now we're intervening immediately, withdrawing, intervening again, trying to find that functional analytic relationship. What's wrong with C? Well, C, we're intervening immediately, but we're only withdrawing. We're never going back to the intervention, and so we're never going to be able to find that functional relationship. If we were using a withdrawal design, we're going to use B because this way we're actually establishing, do we have a functional relationship? And then D, of course, right, we're going straight to baseline. We don't want to do that. We want to intervene as quickly as possible. And so intervening as quickly as possible is going to be B because we're also using the correct withdrawal design. Again, C, you're withdrawing the intervention, but you're never intervening again. So how do we know if there's a functional relationship? So 16 is honestly pretty easy. You just can't argue and fight with the question. The question is the question, right? We're just answering the question. That's our job. We're answering the question, we're getting it right, and we're moving on. 17, Joe attends a quarterback camp during football off-season. At the camp, Joe learns a new way to pitch the ball to his running back, which requires complex footwork that Joe could not previously do. This new way has blank with Joe's old behavior. So we're looking at the new way compared to Joe's old behavior. And what is the new way? Well, the new way is a way to pitch the ball with complex footwork. Joe could not do that before. So the old way is the way Joe used to do it without the complex footwork. The new way has this complex, brand new footwork. So the new way has what with Joe's old behavior? A, functional equivalence. Are they meeting the same purpose? Are they having the same effect on the environment? They are. Both ways are pitching the ball to the running back. So the new way and the old way have functional equivalence. Do they have formal similarity? Well, they don't, because the new way has this complex footwork that Joe wasn't previously doing. So they're not formally similar. They don't look the same. Stimulus control. Well, the new way doesn't have stimulus control over Joel's old behavior, right? Because what we've essentially done is shaped that old behavior into this new behavior. Stimulus control doesn't make a lot of sense. And then stimulus equivalence. Well, no, they're not equivalent at all. He's got brand new footwork, right? They're functionally equivalent, but they're not formally similar. And there's no stimulus equivalence between the two, right? Stimulus equivalence. In addition, we're looking at responses here. We're not really looking at stimuli. So the new way has functional equivalence with Joel's old behavior because it has the same impact on the environment. It serves the same purpose. 18, Amanda is teaching imitation skills to her 5-year-old client, and her goal is generalized imitation. Which of the following is an example of a successful teaching program in the context of this question? All right, interesting question, right? Which of the following is an example of a successful teaching program in the context of this question? Meaning, what was effective? What was successful? What is Amanda trying to teach? She wants to teach imitation skills, and her goal is generalized imitation. So in order to be effective, imitation must generalize. That's what we're looking for because we want to be successful. A, the client watched his brother brush his teeth last night. So this morning, the client brushed his teeth. What do we know about imitation? Imitation has to occur in the moment. A is not imitation. B, the client observes 3 novel behaviors and copies these behaviors without prompting from Amanda. Okay, looks pretty good. 3 novel behaviors, meaning unknown. They copy them, so they imitate them, and there's no prompting. To me, that looks like generalized imitation. C, we always read all of our answer choices. C, the client is told, I do what I do, but by Amanda, and is able to engage in the response, even if the response is novel. Again, what evokes imitation? A non-verbal stimulus. Do what I do, and then engaging in the behavior. It's not imitation. Definitely not generalized imitation, because he's just copying, he's just responding to the SD, do what I do. In imitation, the SD is the nonverbal stimulus. It's the model. And then D, the client observes 3 novel behaviors and with minimal prompting, copies these behaviors. Well, close, but we've got prompting, right? What's more effective? The one with minimal prompting or without prompting? Well, of course, without prompting. So if we're teaching imitation skills, we're going to have 3 novel behaviors that are copied without prompting from Amanda. There are some specific things about imitation that you want to know. And if you're not sure or unfamiliar with what makes imitation, make sure you go read it, okay? Imitation is not as straightforward as you might think. There are a lot of guidelines and rules of what actually makes pure, true imitation. 19, after attempting other strategies, you, a behavior analyst, decide that it is necessary to use a response cost procedure. You instruct the behavior technician to take away a client's tokens whenever the client uses bad language. Following a couple of days of this intervention, the client is now telling his mom he no longer wants ABA therapy at the house. What likely occurred? If we cancel therapy every time a client said they didn't want it, cancel a lot of sessions, right? So we've got to be a little skeptical and cautious here. Okay, what likely occurred, right? What likely occurred given this information, right? Did the client just all of a sudden just decide I don't want ABA? Well, remember, behavior is determined, so something must have occurred. So after attempting other strategies, you say, let's use a response cost procedure. Well, that's your first hint. Response cost is what? What's a negative punishment procedure? And with punishment procedures, we've got to be aware that there's a chance things or people or stimuli will become aversive. So the technician is now taking away a client's tokens whenever they use bad language. The technician is now administering punishment, likely becoming an SD for punishment because the client is saying, I don't want ABA anymore. What's likely occurred is as a result of the response cost punishment procedure, the technician has now become an aversive. So what likely occurred? A, punishment was effective. B, punishment was not effective. Do we know if the bad language stopped? We have no idea what happened to the bad language. We have no idea if punishment was or wasn't effective. We only know if a consequence was effective based on future behavior. And all we know is the client says, I don't want ABA therapy. We don't know anything about the actual bad language. Punishment-induced aggression. Do we talk about aggression here? No. What happened was, or what likely occurred was, punishment created an aversive. Technician kept punishing, forming, right, a relationship. And now the technician is this SD. Whenever I see this technician, oh, I think punishment. And that's not good. That's why we've got to monitor punishment and be very careful with punishment. And then 20, Ricky is a high schooler who enjoys playing video games, but he shows little interest in making friends. When asked if he would like to join a club or a team, Ricky declines and prefers to stay at home after school and on the weekends. His mom puts in a request for ABA services. Before accepting Ricky, what should a behavior analyst do? Okay. Now, we're looking at what? Well, we're looking at Ricky, but specifically what the behavior analyst should do about the mom putting in a request. And what do we know about Ricky? Well, we know about Ricky is doesn't really want to make friends. He doesn't want to join a club or a team. He just wants to stay home. Now, is that socially valid or is it not? It's hard to say, right? We don't know. We don't know how old Ricky is. Well, we know he's a high schooler, but we don't know how old he is. We don't know his developmental level. We don't know anything about Ricky. All we know is the information given to us. He wants to stay at home, doesn't really care about joining a club. His mom wants ABA. What does the analyst do? A behavior analyst should not take on this case. Ricky's behaviors are not severe enough. Now, it's not about severity with ABA. What is it about? About social validity, meaningfulness. We need to determine, is the behavior meaningful to the client and to the stakeholders? Not about severity. It's about social validity. B, a functional assessment should be done to determine if Ricky's behavior for change is socially valid. Yes, before ever taking a client, does it matter, right? Is it meaningful? Is Ricky just a normal kid who wants to stay at home and play video games? Or is it a bigger issue? Well, functional assessment is going to let us know. C, the behavior analyst should observe Ricky in the school setting for at least 2 weeks. Well, no, he's not our client yet, and the school setting is not going to do much good. It's not really what we're focused on here, right? We're talking socially. And again, before we even get to that point, does it even matter, right? Who are we to tell Ricky what to do if otherwise it's making no difference in his life? D, the behavior analyst should ask Ricky personally if he wants ABA services. Well, Ricky has a say, but it's not just, do you want services, yes or no? And again, we don't know how old Ricky is. If Ricky's 19, maybe he does have the choice, right? If Ricky's 15, it's different. Got to use the information given. Information given, what we need to do before anything else is this behavior socially valid for change? If it is, let's take them. If it's not, we're not going to take them. All right. Thanks for watching. As usual, like, subscribe, check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.